Welcome back. The drug Wegovy has become a popular choice to help people lose weight. And now researchers say it could also benefit people with both diabetes and a common type of heart failure. According to a new study, Wegovy improved the health of people with type 2 diabetes who also had obesity-related heart failure with preserved ejection fraction. That happens when the heart pumps normally, but it's too stiff to fill properly. One of the study's co-authors said weight loss is an important factor here, but it doesn't explain all of the benefits participants saw with Wegovy, including a bigger reduction in heart failure-related symptoms. And good news for Medicare and Medicaid patients who might benefit from the drug. The drug is now being considered by certain health plans, given the patients using it are overweight or obese and have pre-existing heart disease. This move may help people struggling with those conditions, but do the benefits outweigh the risks and side effects of using Wegovy? Scripps News Tonight medical contributor Dr. Omer Awan joins us now to dig into these questions. Thank you for joining us, Dr. Awan. Heart disease, the #1 cause of death in America. So this provides some hope to people, but as you mentioned in your article in Forbes, Medicare cannot cover medications that just treat obesity. What is the chance that coverage might be expanded to do just that?
Well, it's going to be expanded, Maritza, and I think those health plans that ascribe to the Medicare Part D, which is the outpatient program, it will absolutely cover Wegovy from here on in. And I think there still will be some hurdles for patients. So, for example, Medicare may still require prior authorizations for patients before they get the drug. Medicaid may also allow or try to get patients to try cheaper alternatives before they are given Wegovy. But with that said, I think this is a big move with respect to obesity, heart disease, considering the fact that so many people in America are obese. And as you said, heart disease is the leading cause of death here in America.
So whether we're talking about obesity, heart disease, diabetes, or something else, there are people who criticize what they call a dependency on pharmaceuticals. They say many health decisions should come down to a lifestyle change. So what would you say to those critics?
I would say they're partly right, but at the same time, we have to remember that obesity is a really complex disease. And I think it really requires a multifaceted approach to target obesity. So of course, and absolutely, it starts with diet modification, exercise, counseling, behavioral therapy, but there are many Americans, millions of Americans, Maritza, that have tried diet, have tried exercise, and are still obese. I mean, we're talking about 100 million Americans who are obese. That's a huge number. So, I think this is a relief for a lot of those Americans that A, can't afford this drug, and B, have been struggling with obesity for so long. Now this drug comes, it's being offered by or covered by Medicare. I think it's a huge relief, and it could really curb this obesity epidemic that we're seeing here in America.
And so much of it comes down to genetics, too, which so many people talk about as they struggle to lose some of that weight. With this drug, this possible positive outcome for heart disease is there, but are there also negative effects that come along with these drugs, including, there were some studies that showed possibly causing thyroid C-cell tumors in rodents. How do you feel about the argument that the bad could outweigh the good here?
Well, nothing is perfect, right? And certainly medications, that's absolutely true, right? So all medications have benefits and all medications have side effects. And that's true with Wegovy as well. So generally speaking, Wegovy is a very safe drug. I mean, we have side effects that include nausea, vomiting, constipation, diarrhea. But as you said, in a small percentage of patients, it can have very serious side effects, things like, gallbladder issues, inflammation of the pancreas, even suicidal thoughts and depression. And as you stated, some types of thyroid cancer. So I think what needs to be done as more and more people are starting to use the drug, these patients need to be monitored very carefully by their primary care physician to make sure that they're not developing these side effects. And these side effects will be amplified because as more and more people get this drug, we're talking about potentially hundreds of thousands, even millions of people having access to this drug. So very important for physicians to monitor for important side effects.
Yeah, and you wrote about that specifically in this article in Forbes, saying that we should see more side effects as it's prescribed more and more. That's just the math in it. Anything in particular you're watching for?
I think there will be unintended consequences as well. So, first of all, people tend to, use a drug sometimes for the short term. They'll use it for weight loss and then they'll stop. Well, these drugs are really meant to be used for the long term. So I think it's important for people to use a drug as it's prescribed. And also, I think patients will start to blur the line in trying to present themselves for heart disease to try to get the drug cheaper, right? So, for example, what do I mean by that? Well, what I mean is, let's say you have transitory high blood pressure. You have, high blood pressure sometimes, but not most of the time. Well, does that mean that you're at risk for heart disease? Does that mean that you qualify with your physician to potentially get Wegovy through Medicare? And maybe physicians will blur the line as well. So they may also be willing to prescribe the drug because it may decrease their risk of heart disease, even though that patient didn't really have a significant amount of risk for heart disease or stroke. So I think the blurring of these lines will start to become much more apparent, and that'll be an unintended consequence for Medicare taking on Wegovy.
All right, Dr. Omer Awan, it's always a pleasure to talk to you. Thank you so much.
My pleasure. Thanks so much.